Hello everyone and welcome back to Stir the Coco. If you're new to our show, welcome. Here we talk about anything and everything that stimulates your coco. Coco is a word in Spanish for your noggin, your brain. So remember to follow us on YouTube, Stir the Coco, with myself, Posh Teacher, and here at BCTV. Give us a like and subscribe on both platforms. We greatly appreciate it. We are calling this episode the mouth-brain link. Did you ever think there was more to oral health than having a nice smile and good breath? Well, more research is saying yes. Let's dive in. If someone has gum disease, which is an infection and inflammation of tissues that support the teeth, including the gums and bone, if this progresses, small wounds in the gum lining can allow harmful bacteria to enter the bloodstream and reach the brain, your coco, even during everyday activities like brushing, flossing, or chewing. One key bacterium, Porphyromonas gingivalis, plays a major role in worsening gum disease and may be linked to Alzheimer's disease. It can invade the brain, damage neurons, and contribute to the formation of harmful amyloid plaques. This bacterium also releases toxic enzymes called gingipanes, which are powerful protein-breaking compounds found in infected gum tissue. A 2019 study in Science Advances found gingipanes in 96% of brain samples from deceased Alzheimer's patients and in the spinal fluid of living ones, suggesting a strong connection between gum disease and brain degeneration. A study published on July 5th, 2023, in Neurology, the medical journal of the American Academy of Neurology, found a link between poor dental health, specifically gum disease and tooth loss, resulting in brain shrinkage in the hippocampus, the brain region responsible for memory and associated with Alzheimer's disease. Conducted in Japan by Dr. Satoshi Yamaguchi and colleagues at Tohoku University, did a study that involved 172 adults. The average age was 67, who had no memory issues at the start. Over 4 years, researchers tracked their dental health, their memory performance, and hippocampal volume through brain scans. The key findings: in people with mild gum disease, having fewer teeth was linked to a faster brain shrinkage. Number 2, in those with severe gum disease, having more teeth, possibly diseased, was also linked to a greater hippocampal shrinkage. Losing just one tooth with mild gum disease equated to almost 1 year of brain aging. Retaining a tooth with severe gum disease could lead to brain shrinkage equal to about 1.3 years of aging. The study suggests that it's not just about keeping your teeth, but keeping your teeth healthy. Severe gum disease may require tooth extraction and replacement to prevent further brain decline. While the study shows an association and not a causation, it highlights the importance of oral health in cognitive well-being. Researchers call for further studies with larger and more diverse populations. But today we will dig deeper into this topic with Nicole, our guest. But before, let's go off to our brain-boosting Spanish class. Here we go. For good oral health, you need a toothbrush and a toothpaste. So our phrase is I need a toothbrush and toothpaste. Necesito un cepillo de dientes. And yes, it's actually a Hello Kitty. Y pasta de dientes. So, again, necesito un cepillo de dientes y pasta de dientes. One more time. Necesito un cepillo de dientes y pasta de dientes. Bravo! And remember, the word necesito followed by any noun. In previous episodes we learned the word for water can work with necesito. So if you want to say, I need water, and there's water in my mug, I could say, necesito agua. Necesito agua. You're super thirsty, and you can say, necesito agua. Muy bien. As your homework, watch previous episodes of Stir the Coco here or on YouTube and write down words that you can use with necesito. Put one of your sentences in the comments of the show or on Stir the Coco YouTube. And Posh Teacher will check your work and give you feedback. Because we are all going to go to the dentist so we can have healthy teeth and gums, the dentist will say, open your mouth. Abre la boca. Abre la boca. One more time. Abre la boca. Side note, Spanish has formal and informal ways of speaking. Meaning, if you talk to people you know versus your boss or someone you just met, then that is how we associate informal and formal. Today, the word abre was used in informal form because after going to the dentist, people, get to know you and the dentist gets to know you, so we use informal. Our next word is, what a beautiful smile, because you got your teeth cleaned, right? So here we go. Qué bonita sonrisa. Qué bonita sonrisa. One more time. Qué bonita sonrisa. All right, let's review. I need a toothbrush and toothpaste. Necesito un cepillo y pasta de dientes. Next one, you're super thirsty. Necesito agua. Good. And you're at the dentist, open wide. Abre la boca. And what a beautiful smile. You just got your teeth cleaned. Qué bonita sonrisa. All right, let's go off to talk with our guest, Nicole, today.
Bloomfield Township Senior Services promotes wellness and strengthens the community through social connections, fitness classes, aquatics, day trips, and more. Our staff is here to serve you, offering lifelong learning and interactive opportunities for residents age 50 and above. Invest in your vitality with us. Follow us to learn more and stay up to date. We look forward to meeting you.
Hello, everyone. Welcome back to Stir the Coco. And I'm very excited to introduce our guest, Nicole Gibbons. She is a dental hygienist with Dentistry by Dairy. And Nicole, welcome to our show.
Thank you so much for having me. I'm so excited.
Well, we are excited to have you because this topic is very important, what we're going to be talking about. But first of all, share with us your journey that led you to pursue a career in oral health care.
Yes, so my journey starts a long, long time ago.
Oh, good. We're ready.
I have always wanted to be a hygienist. I, as a child, wanted to play dentist with my friends, real creepy little kid.
Oh my God, love it. Okay.
Love it. My grandma was a dental hygienist at a pediatric office, so all of my dental experiences, thankfully, when I was a kid, were pleasant, and I enjoyed it, and I just always had a good correlation with the dentist. So, I would even write the tooth fairy letters please take my tooth, but please leave me money too. I would like to study the tooth. Don't take it away. Like, it's sick.
That's great. No, we need people like you.
Yes, so I knew I always want to do something with teeth. So, fast forward to like my senior year of high school, and financially I wasn't sure college was an option for me. So I was like, you know what, we'll get there eventually. And we had a career day. Somebody came from Baker College, which had a hygiene program at the time. It no longer does. But they're like, hey, if your GPA is a certain amount, it's half off tuition, and we have a dental hygiene program. And I signed up that day, and 10 years later, well, 15 years later, but 10 years of practice later, here we are. So,
oh my gosh, so it's in your heart.
Definitely, definitely. I never thought of doing anything else.
Oh my God! Well, you're always so energetic, and you can tell you love your job.
Thank you.
It's so great. Well, let's dig into dental world. Obviously, over 10 years experience, what things have you seen that patients do not prioritize with their oral health care?
Yeah, there's a couple of them.
Please,
So,
we're ready.
I think the biggest joke out there is that like people don't floss, right? Like
Yes.
always like, oh yeah, sure, you're flossing. But sadly, it really is true. And it's not that people aren't flossing. It's maybe they don't know how to floss properly, or they don't realize there are other mechanisms, other ways of cleaning between teeth. So it's not just the string floss. They have those lovely floss picks that give you a little extra dexterity, especially for our older population who have a hard time kind of with those finite dexterity issues.
Yes. That's great to know.
Something like this, like a water pick. This is a cordless one. It's so much easier than those big countertop units. Bring it in the shower, make a big mess. They've gotten closer and closer to being as effective. I mean, they're really, really close. We still say we want you to use traditional floss in some sense, but if you're using the water pick the majority of the time and working in some regular floss, you're going to be hitting your floss goals. So I think that's something that a lot of
especially
people
for our older
still-
population.
Exactly. So a lot of people still aren't hitting, it's once a day. We're not asking you to floss
Oh,
twice
it
a day.
is once a day. Okay,
Brush
okay.
twice, floss once.
Okay.
If you floss more, awesome. More power to you.
Okay.
But it is something that, a lot of patients just admit to me, like, I don't like it. I forget about it. Whatever their hang up is, my teeth are too tight, things like that. So I hear a lot of excuses about it. But I think the other thing that people don't realize is, most of us as children were taught, brush and floss your teeth so you don't get cavities.
Yes.
But we don't really think about gum disease and the bacteria that lives in our mouth. We have so much bacteria in our mouth. It is the gateway to the rest of our body. So if we're not removing that plaque and bacteria from between the teeth on a regular basis, that's going to sit in there and do some stuff. So
oh my gosh.
that is the big one I'm really passionate about. One of my favorite little silly tidbits, and I mostly do it with children.
Okay,
I'll
no,
sneak it in with
I'm a
adults.
kid at heart. I love
Yes.
Hello Kitty. Hello.
So-
So, tell us.
If you don't floss regularly,
Yes.
I always tell my kids this: go home, floss your teeth. Before you throw that floss away,
Yeah.
smell it.
Brother,
Ew.
And I bet if you floss, it's not going to smell too great. And I'm like, that's what your breath smells like.
Oh my God. That's yay.
It's a little inappropriate to say for adults, so in a nicer way I will. But
Yes.
it's so true. People are like, my kid has the worst breath. They brush their teeth. I'm like, do they floss? Well, no.
Wow. So that's where it is.
That's a big
the
one.
secret sauce.
Yeah. And the other thing would be, toothbrushing. I think a lot of people minimally hit that once a day toothbrush. We know we're supposed to be brushing twice a day, morning and night, right?
Tell me about the toothbrushes. Like I just got this for my birthday. It's a Hello Kitty electric toothbrush.
Love it.
And it has all these features: clean, white polish, sensitive. Are these gimmicky? Do we really need this, or old-fashioned?
Great question. So I tell people all the time, with a manual brush,
Yes.
in the perfect scenario, you can do an excellent job with your oral hygiene. But across the board, I recommend an electric toothbrush to everyone.
Oh.
It's my personal preference. Studies show that you're less likely to scrub too hard with an electric toothbrush, so you're less likely to have a recession later on in life. The built-in timer is wonderful. A lot of those have a 2-minute timer built in, and people don't know this.
Yeah,
They
that's
only
true. I
brush
gotta read the
for 45
directions.
seconds.
Oh, you're right. That's why it just stops. Hello.
No, stop after 2 minutes. So you have brushed for 2 minutes at least once. Good.
That's about it.
But no, it brushes 10. It can remove 10 times more plaque in that same window of time than you can with the manual. So
10 times more
10
plaque.
times more plaque.
Okay, that's something we have to keep on. Okay,
Yes.
so this is the best birthday present
I love
ever.
it. I love
Okay.
it. I go back and
That's good to
forth.
know.
I use both. I use a manual at work and an electric at home, but it always feels better to me. With my
At
electric.
work. So you brush your teeth at work?
Yes.
Tell us about that.
So, because I work in a dental office, obviously I have free range of toothpaste and toothbrushes.
Yes.
So I brush my teeth when I wake up. I usually drink my coffee on the way to work. And then before I see patients, I'm like, I can't have coffee breath. So I usually do that. And then after lunch, I brush too. Now, if you want to be a superstar, you can do that. Brushing after every meal is like the perfect. But twice a day is all we ask of you. So I do usually brush my teeth once or twice at work with a manual toothbrush.
Oh my God, you really love teeth.
Yes, I do. And it's like, you don't need your hygienist having, stinky breath after lunch either.
No, because it's a very close
Exactly.
situation.
Close proximity, yes.
Well, next I want you to share then what things can manifest in different parts of our body if we do not have good oral care.
Yes.
Tell us about that.
So I know you talk a lot about inflammation, right? That is a huge factor to not only future cognitive decline, but just so many comorbidities.
Absolutely.
There have been studies that show up to 85% of adults over 65 have at least one chronic inflammatory disease.
Oof, that's a huge.
Periodontal disease, which is advanced or established gum disease, counts for about 60% of those inflammatory diseases. It is one of the most common inflammatory disease that not only the world, but definitely in the United States, as far as what's been studied. So it's a big problem. It's a big problem. And, there have been studies that have shown not only a direct correlation from, periodontal disease infection, bacteria in the body to cause cognitive decline, even connections with dementia and Alzheimer's. But then there's also the reverse duality. So not only can that cause these things, but once you have these things, then you're also going to have potentially more periodontal disease because of lack of dexterity, memory issues, living in care facilities that aren't helping facilitate proper brushing.
I think there's more. People need to know
so
this more.
It kind of goes both ways. And there have just been more and more studies as these baby boomers age that we're getting a lot of data that shows, if we could just curb this one piece of the puzzle, if we could get this periodontal infection problem under control, we would really hope that people would have less other comorbidities and other problems.
Why do you think that's being ignored is it being an issue that's being ignored in our society, especially with our older population? Are nursing homes not aware of this? What can we do to change that, create awareness?
So that is something that I try at an early level when I have patients who are 20 years old. They've probably never really heard about gum disease, and it's not the fault of their previous dentist or hygienist or other people they've seen. It's just not discussed because we don't see it that often.
Yes.
But it can start that young. And so if we're given the information at an early age and an opportunity where hopefully they're listening to us in that safe space in the dental chair, hopefully future generations will have less and less problem. The other part of it too is these previous generations, when they were children, they didn't necessarily go preventatively for hygiene appointments. They went if they had a toothache.
Yes.
We have a lot more education, a lot more access to information. We can Google, hey, is this normal? Whereas, 20 plus years ago, it was just like, I'll ask my aunt, I'll ask my mom.
Yes, you're right.
So that is a big part of hopefully a shift that we'll see in the future with like less tooth loss, less gum disease, things like that. I think the other part too, unfortunately, is, we see them going up on every corner, these new nursing homes, skilled nursing facilities, as our population ages.
Absolutely.
And unfortunately, they do have a harder time keeping staff, training staff, and dental care tends to be really low on the priority.
Oh my goodness.
It's probably lack of education. It's not that it's the fault of the caregivers in those facilities. They just don't necessarily know better. So for instance,
here we are to tell everyone,
exactly.
Please make it a priority.
Care. If you have a family member, a friend who's in a facility like that, maybe they have dentures. Maybe the staff doesn't know this. Those need to come out at night. They need to be brushed. They think, well, they don't have any real teeth. I've got other problems. So there's these little things that I think it's not an intentional ignorance. It's not an intentional, we don't really care about that.
Right.
It's that they just don't know. It's a lack of education and a lack of support staff to kind of help facilitate
Well,
those
we're going to
things.
make a mission to bring awareness.
Yes.
Because we
that
need
is
to care for
near and dear to my heart.
Yeah. I'm so glad you're here to tell us that.
Yes.
Well, we want to ask you one more thing here. What are preventative things that we can all do
Absolutely.
to avoid gum disease?
Number one is see your local friendly neighborhood hygienist every 6
And
months.
how adorable and so sweet.
Thank you so much. Thank
I
you
really
so
do
much.
enjoy going.
I
because,
appreciate
yes,
it. You know,
the
so many people have a lot of fear and anxiety about dental for whatever reason. Bad
absolutely.
experience as a child, cost, access to care.
Hearing
There's so
funny
many
noises, you know,
Yes.
drills or all
Oh,
that.
the anxiety of it all. But I mean, that is huge. We have the opportunity in that, 30 to 60 minutes, however long we have with you, to not only educate, help you tweak your, you're doing a great job, but you're just missing here. It's like, well, thank you. I didn't know that.
Good.
So that's super important. Of course, we already touched on brushing and flossing.
Yes. Is that why you have your little
Well,
guy over here?
this will lead me into another part. So
Yes, tell us about
So
the little
another
guy.
thing is, the bridge fell off. Well, anywho, replacing teeth.
Okay,
So-
tell us about that. We have a few minutes.
Yes,
I would
there
love
has
to hear
also
it.
been a huge correlation and connection with cognitive decline and missing teeth. So it's a new thing we don't have a lot of information on yet, but
Yes.
it's new and we're experiencing these things that we're, when people get older, a lot of them lose teeth. And if we don't replace them, not only are they not chewing properly, they're not hitting their diet goals, they're not hitting their nutrition goals, they lack confidence. There's so many things.
Wow, so it just
They don't
trickles
want to
down.
smile. Mental health tends to decline when you don't want to smile and you're not eating well. So there's just so many little connections
so sad.
that if we can get, we get on that. Not only do we have bridges and partials and dentures, we now have dental implants, which is the standard of care.
Beautiful.
They are treated more like natural teeth. You don't take them in and out. There's just so many
my
things out there
goodness.
that we didn't have before. And
So
it all
there should be
starts
no
with-
fear. I mean, and look, you can have a
Yes.
beautiful smile.
Yes, we
Look
can
at that.
complete all these different things that can be done to help, bring you back to health. And, that it just starts with making that appointment, as scary as it might be. Just get in, see your dentist. If you don't, have one, find one, and we're here to help. So
I really appreciate your time and
Yeah.
bringing awareness. And there is a light bulb and a positive aspect to this. It's not, there's hope, right?
Yes.
And there's things we can do.
I really want people to know, if you've had a bad experience in the past,
Yes, please.
they're not all like
comfort
that.
everyone.
They're not all like that.
Okay,
There's
that's good to know.
really good dentists out there, good hygienists and other professionals who want to listen. They're not there to judge. So the scariest part can just be making that appointment and showing up. You just got to do that, and
I
then
love
you can
that.
take it from there.
I love it. Well, on that happy note, we'll make you even happier by asking you a
Oh, boy.
question.
Okay.
So this is our tradition. This is the manzana, the apple. Yes. So I'm going to pull out a question and ask you, Nicole.
Sure.
Okay. Don't get nervous
Okay.
because, like at the dentist, get calm.
Right.
All right. Here you go, Nicole. Have you ever had a patient fall asleep during a cleaning?
I actually have. I actually have.
Give
It's
us
happened
a little 30-second
three
recap.
times in 10 years.
Oh my gosh.
2 of them worked night shift, came in for a 7 a.m. appointment, which was their bedtime, and started snoring. Yes.
Oh my goodness.
The 3rd time was an elderly woman who I was a little nervous. I'm like, Mrs. Jones, Mrs. Jones.
Oh gosh, yeah.
She was like in her late 90s.
Oh,
and the
wow.
sweetest little thing.
Good for
So-
her going in her 90s.
But no, she was just a little sleepy.
A
So
little
she just
bit.
dozed off, and I took it as a compliment. I'm like, I must be just so
Yeah, so relaxing.
So it has happened. It has happened.
Oh my God, I love it. Thanks for sharing. I'm like, no, I'm sure it's never, but well,
it has.
thank you for sharing.
Absolutely.
Well, now we're going to share with you one quick little phrase in Spanish. Brush your teeth, whatever
Ooh.
ways we can manage. So here we go. Cepillate.
Ooh.
Repeat. Cepillate. That means brush. Cepillate.
Cepillate
Los
los
dientes.
dientes.
There we go. One more time.
Okay.
Cepillate
Cepillate
los
los
dientes.
dientes.
Dientes. Sorry, think of dentures.
There you go. There you go.
Muy bien. Well, you can use that with your Spanish-speaking.
Yes. I would love
clientele.
to interpret that or to incorporate
yes.
that. Yeah.
Cepillate los dientes. So there we go.
Cepillate is a lot of
There we-
syllables for
I know.
brush.
Oh, you know what? Point and go dientes.
Dientes.
There we
Okay.
go.
I can do that. I can
We'll
do that.
shorten it for you. Well, thank you so much for being on the show,
Thank
Nicole.
you.
It
I
was
thank
such
you
a
for
joy.
having me. I appreciate it.
Thank
I really
you so
do.
much.
Absolutely.
And filled with knowledge. So thank
I
you so much.
appreciate it.
All right. Bye-bye. Adios. Adios, everyone.